Good evening. My name is Michael David, and I'm from United States University, MSN 572 student, nursing practitioner student, I'm sorry. And I'm here to do the head-to-toe examination with my guest over here, Mr. David. So we're about to get started. So we're going to introduce ourselves first, but before we actually see the patient, we have to make sure we have to wash our hands or use a hand sanitizer. Right, so now our hands are sanitized, we can now go to our patient and greet them. Hi, Mr. David. My name is Michael, and I'm going to be your nurse practitioner today. And we're doing a head-to-toe examination. And before we start, is it okay if I get consent from you to get a recording on your camera?
Yes, you have my consent.
Thank you very much. So we can get started then. So, Mr. David, how are you today, sir?
I'm good.
Any problems so far, or how did you actually get into our clinics over here? Did you drive yourself?
I drove myself.
You drove yourself, very good. Okay, well, that's good to hear. Tell me, what brings you to our clinic today?
I'm here for my annual physical.
That's very good. So you're here for annual physical. Before we get the physical, I'm just going to have to ask you a few questions. Do you know, can you give me your full name, please?
Nathan L. David.
Very good. And do you know what the date today is?
February 19th, 2022.
And do you know what time it is?
Yes.
Okay. Do you know what we're doing here today?
Head-to-toe examination.
Okay. Well, physical exam. The physical exam. Okay. But you know where you are at the moment,
Yes.
right? Okay. So with that being said, we actually know that the patient is actually as good is alert and oriented. Yes, he's oriented he's oriented to place, time, and situation. He presents himself here knowing full well what's going to happen, and so we can get started with the exam itself. So when was the last time you had a physical exam?
About last year.
Okay, and since then, did you have problems with mental or psychiatric concerns?
No.
Did you have any problems with infectious disease or anything like that? How about any allergic reactions recently?
No.
How about injuries or that caused hospitalization?
No.
Have you had any procedures that required surgery?
No.
Okay. Have you had any problems which involves sexual encounters like STDs?
No.
Okay. And do you have any problems when it comes to allergies or anything like that?
No.
Okay. Well, if that's the case, then well, we're gonna move on, and since he has no other problems, any other history of any problems since the last exam, so we're gonna move on to his family history. So I'm gonna ask a few questions about your family. So how are your grandparents and parents so far?
They're well.
Are they still alive and living?
Yes.
Yeah, okay. Do you have any siblings at all?
No.
Okay. Do you know if any of your family actually suffered any chronic illnesses in your history?
No.
No. Okay. Any of them have any problems or any history of head, ears, nose, and throat problems?
No.
No. Any of them had any heart problems at all?
No.
How about any lung problems?
No.
How about any breathing problems?
No.
Okay. Any problems with the intestines or digestive tract or the abdomen?
No.
Any problems with urination?
No.
How about bowel movements?
No.
Okay. Any problems involving the endocrine, which involves the thyroid, or problems with tolerating heat and cold like that?
No.
Okay. Any problems, any history of weaknesses or any history of paralysis or seizures at all?
No.
Okay. Any other problems with depression or anxiety?
No.
Okay. And any history of obesity?
No.
Any history of cancer?
No.
Any history of bleeding problems? Do you have any history of joint problems?
No.
Or muscular problems at all? And do you have any problems? Do you have any other problems with involving allergies or things like that?
No.
Okay. So with that being said, it seems like the family and the background of Mr. David over here didn't have any problems at all. So everything is doing well. So now we can proceed to your own social history. So, Mr. David, where were you born actually?
London, UK.
Very good. Do you know when you were born?
January 13, 2004.
Okay. Are you married or are you single?
I'm single.
Very single. Okay. What kind of work do you do so far?
I am currently unemployed.
Oh, okay. Are you perchance in the military?
No.
Oh, okay. What are your living conditions at present?
I currently live with family.
Oh, okay. You live with family. What about eating habits? How's your diet? What do you mostly eat?
I'm not very picky with food.
So you can't eat anything. And hydrating wise, you drink plenty of water. So
Regularly.
regularly. Okay. Do you do any exercise?
No.
Oh, okay. Do you like to drink coffee? Do you drink coffee or
Yes.
caffeine? Okay. How often do you drink caffeine?
About 2 to 3 times a week.
Oh, okay. Do you smoke?
No.
Do you drink?
No.
Have you been involved in illicit drugs?
No.
Okay. Have you had any problems with any allergies at all? I'm sorry.
No, not that I'm aware of.
I'm aware of. Do you have any problems with? Do you have any problems with mental? Do you have any mental concerns or psychiatric problems?
No.
Okay. Do you actually use alternative medicines for something?
No.
No. Okay. And for safety, what do you usually do when it comes to safety concerns?
I use a seatbelt in any vehicle.
Very good. So I guess everything seems to be good with your social history. We've got a good idea on how Mr. David takes care of himself. So now we can proceed to a review of systems and see how he answers some questions regarding his general state of health. Mr. David, right now, how are you feeling in general? Do you feel like any nausea or fevers and chills or any weaknesses like that? Or
No, I'm well.
You're well. Okay. Do you have any problems with your eyes? Like you have any blurred vision, loss of vision, or flashing of lights? Like that? No. Do you have any problems with headaches? You have problems with swelling in your head, or lumps in your head like that, or anything involved with your head as well?
No.
No. Okay. What about your hearing? How is your hearing so far? Do you have problems with hearing? Do you have any loss of hearing? Do you have any ringing in your ears?
No.
Okay. Do you have any with your nose? Do you have any problems with smelling or difficulty breathing or blocked sinuses like that?
No.
No. Okay. With your mouth, have you had any problems with chewing food, swallowing, or any lesions in your mouth?
No.
Any tooth decay? When was the last time you actually seen a dentist?
Around this time last year.
Okay. What about your eyes? Have you seen an eye doctor regularly?
Mhm.
Okay, very good. So you have the exams last year too.
Yes, around the same time.
Very good. Any problems with your heart? Like you have any chest pain or shortness of breath when you walk a small distance, or sudden drop of blood pressure when you stand up in the morning?
No.
Okay. No. Do you have any concerns with your breathing? Do you have any cough? Do you have any wheezing?
No.
No. Okay. Do you have any problems with your stomach? Like, do you have problems with constipation or diarrhea?
No.
Okay. Do you have any problems with your peeing, like pain on urination or blood in the urine? Is that that? No. Okay. Do you have any problems with the dementia or forgetfulness or memory loss?
No.
No. Okay. Do you actually have any problems with depression or anxiety? Okay. And do you have any problems with bruising, easily bruising, or when you scratch yourself, do you have any problems healing faster or is it any slower?
No.
No. Okay. And how about any problems with allergies so far?
No.
Okay. So so far with the review of systems, Mr. David over here seems to have no problems. He has denied any abnormalities in general. So now we're going to go more in depth by going for the physical exam. And with the physical exam, before we start with the physical exam, we have obtained some data. First, we have his height and weight. His height is 5'9", and his weight is 133 pounds, which gives him a basic body mass index of 19.6, which is just about normal. And also, we also took his blood pressure, which is 1/70. His heart rate is 86. His respiratory rate is 20, and his temperature is 96.9. So now we proceed now to inspect and do this physical exam on you. First, we're going to inspect your hair, your skin, and your nails. So I can see that your hair seems to be silky smooth, well distributed. I don't see any brittleness or dryness. Your skin appears to be good and intact. I don't see any lesions or any scarring or any erythema. And can I have a look at your fingers, please? And I see that your fingernails and your hands appear to be in good color. They're not cyanotic. I don't see any evidence of clubbing. And everything is symmetrical. So now we'll proceed now to the head part. With the head, his head is asymmetrical. No problem. It's symmetrical. I'm sorry, symmetrical. I don't see any bumps or lumps or any lesions whatsoever on the head. So I'm going to palpate the head and check for any other abnormalities there. And yes, there's no problems with the head. Everything seems to be intact. The distribution of hair is good. There's no alopecia or anything. And now next we proceed to the facial part. We're going to check on the face and see if the face, if there's any problems with the face. The skin is good. I don't see any other problems. There's no lesions. There's no scarring. There's no erythema, and there's no macules or pustules over there. And we're going to check your sinuses and see if they're okay. Let me know if there's any pain.
No.
There's no pain. No pain.
No.
Okay, no pain. Okay, so there's no pain on your sinuses, and they seem to be intact. And now we're going to check for his TMJ to see if there's any crepitus in there. I'm going to check your jawline if that's okay with you. So I'm going to check his jawline and check for any problems in his jaw. And I want you to open and close your mouth. Okay, good. And move your jaw around. Okay, all right, very good. Okay. So far, do you feel any pain there?
No.
Good. So far, this jaw seems to be moving fine. The mastoid and the temporal muscle seems to be working fine, which indicates that his cranial nerve, his trigeminal nerve, which is the cranial nerve number 5, appears to be working fine. And while we're also palpating the TMJ, might as well palpate the temporal arteries and see if they are okay. All right, the arteries are very good; they're pulsating very well. And now we're going to proceed to your facial muscles, which is going to be cranial nerve number 7. We're going to, like I said a while ago, upon inspection, the face seems to be okay, and we're going to check for sensory sensation in the muscles. This also, actually, sensory muscle is also involved in with the facial muscle. So I'm going to check for sensation. So I want you to close your eyes, and then you tell me if if you can feel which part of your face am I touching. Okay.
Left cheek, right cheek, forehead, nose, chin.
Okay, very good. So he felt that the sensation is quite normal, which means that his facial nerve, which is cranial number 7, trigeminal nerve facial nerve is actually working fine. Now we're going to test to see if the facial muscles are working. So can you smile for me, please? Can you frown for me? Puff your cheeks and wrinkle your forehead. Okay. So again, the facial nerve is working because it was able to perform all those facial expressions with no problems whatsoever. Okay. Now we'll go to the next part, which is going to be the eyes. You're going to check your eyes first. And before we do that, we're going to check for your visual acuity. So I'm going to step back 6 feet, and I want you to stand over that side and cover your left eye first. And you're going to read the last line of letters in this chart, okay? Okay, a little bit back on the phone. Okay, right. Cover your left eye and read. Yeah, cover it completely. There you go. Cover it completely. That's it. And then read the last part.
LTFPH.
Very good. Okay, now cover the other side.
LTFPH.
Very good. Okay, have a seat. So his visual acuity is 20/20. He was able to discern the letters from 6 feet apart. So now we're going to check your eyes using my otoscope. And by the way, when we check the acuity of the eyes, it's actually cranial nerve number 2, which is the optic nerve. So with the otoscope, we're going to check the eyes for red eye reflex. So I'm going to check for red eye reflex. Just look straight. Okay, there's red eye reflex on both eyes. Okay, and now we're going to check each eye for any problems in the retina by looking closely. Looking at each eye using your right eye to your right eye, your left eye to your left eye, and holding the 3 fingers forward so that you can have some distance between the instrument and the patient's face. So I'm going to check the eye first. Okay, I'm going to check the right eye right now. Okay. I'm going to check the left eye now. Oh, sorry. I'm sorry. So the left, we check the eyes with the otoscope. There's red eye reflex. The retina seems to be okay. There's normal disc to cup ratio. There's no cotton wool spots seen. His iris, his sclera seems to be fine as well. It's not jaundiced. It's not icteric. There's no redness as well, and let's check also your iris blood. Okay, they're pale and pink, just not red, which means there's no signs of infection over there. So now we've done that, we can also check for your eye movement, extraocular movement. So in this testing, we are actually testing for cranial nerves 3, 4, and 6, which is the oculomotor, the trochlear, and the abducens nerve. So I want you to focus on this this highlighter, and I'm going to move it around. I want you to follow it with your eyes, okay? Very good. Now, I want you to focus on that flower over there, and focus your eyes over there while I'm doing. I'm going to focus. Put this pen right in front of you. Okay. Okay, that's good. It has with accommodation of the eyes, and all of the muscle reflexes are present. It was able to see in all directions, and which means that all the nerves are functioning very well. And then we should also check for pupillary reflexes. And I'm going to use my my pen light and check for direct reflex and consensual reflex as well. So I'm going to cover one of your eyes. I'm gonna do check the reflex on one eye first, okay? Very good. Very good. Right, I'm gonna shine one eye directly, just look forward so I can check and see if there is actual equal reaction in both eyes regardless, okay? Okay, so there's both direct and consensual reflexes of the pupils. They're both reactive to light accommodation, and, and everything seems to be working fine. So now we're done with the eyes. Now we're going to move on and inspect your ears. As far as I can see, the ears have no problems whatsoever. I don't see any swelling or redness on both ears. I don't see any discharges at all, and they're both symmetrical. So now let me actually touch the tragus of your ears. There's no swelling. Check the auricles. There's no swelling whatsoever. So everything seems to be good. And now we're going to check for his hearing by doing 3 tests. First, we're going to do the whisper test, in which I'm going to whisper a few words, or a couple of words, either side of the ear, and see if he can hear what I'm saying. So I'm going to say one word on this side, and repeat after me if you hear it, okay?
Radio.
Okay, so he passed the whisper test. He heard the sound on both sides. And now we're going to go and get our tuning fork. And we're going to do the Weber's test, in which we're going to test to see if the balance of the hearing on both sides of the ears is equal. So what we do is going to hit the base of the tuning fork. We're going to put it in the middle of your forehead and tell me if you can hear on both sides equal.
Yes.
Okay. So she passed the Weber's test, because if there's any problems with your lateral hearing, you won't hear from the other side. Now we're going to test for the rinse test, in which we're going to test bone conduction versus air conduction. So I'm going to hit the tuning fork again, and I'm going to put it behind your ear where the mastoid bone is, and we're going to see if the conduction there is good compared to your ear. Okay. Where it stops.
Stop.
Okay, cool. That was long. Okay, we're going to test the other ear again, or the other ear this time.
Stop. Stop.
Very good. So he passed his rinse test. His bone conduction is shorter than the air conduction. So now we can move on and check the insides of your ear. This time we'll use our ophthalmoscope. Well, our otoscope. Okay. We're gonna check your right ear first and see what's One side there. So, let's move your hair a bit. Oh, we forgot to put the probe. Oh, there you go. I have two probes here, one for each ear. There we go. Pull back. That's it. Okay. Now the right ear is clear of any impacted ceraman. The cone of light is at 5 o'clock. The color of the tympanic membrane is pearlescent gray. It's not swollen. It doesn't seem to be reddening. So everything there looks good. So now we're going to try the other ear. Okay. Sorry about that. Okay, same as this one. The ear seems to be intact. Nothing is blocking the way. The cone of light is at 5 o'clock, and the eardrum is also, or tympanic membrane is pearlescent gray. There's no signs of an infection or reddening or swelling inside. Okay. All right. So now we're done with the ears. We're now going to check for your mouth. Upon inspection, the mouth seems to be not cyanotic. I don't see any lesions at all. No cracking or drying of lips. And if you open your mouth, please, for me. Can light open your mouth. Okay. I don't see any lesions at all. The buccal mucosa seems to be intact, pink and moist. The mouth is pink and moist. The teeth seems to be good. No dental caries, no cavities. Okay. So that we're going to check for the mouth. We're going to check for any the cranial nerves, cranial nerves 9, 10, and 12, which is the hypoglossal, the vagus, and the glossopharyngeal nerves. So first we're going to check for cranial nerve number 9, which is glossopharyngeal. So what we're going to do is we're going to check to see if how's your swallowing. So can you swallow for me, please? You have no problem swallowing at all? Okay, thank you. And I would try to do the gag reflex, but I don't think it's going to be appropriate right now. But a gag reflex is also part of the glossopharyngeal nerve. So that we'll try for the glossopharyngeal number 10, which is the biggest nerve. What I'm going to do is I'm going to use the spoon as a tongue depressor, and I'm going to ask you to say ah, so we can see if the insides move out. Okay? So open your mouth, look up, look, and say ah. There we go. Very good. So as soon as the patient said ah, the uvula actually deviated to one side, to each other side, and then went up as well. So his vagus nerve seems to be working very fine. Everything seems to be intact with that. And now we're going to check your tongue with cranial nerve number, which is number 12. I want you to stick out your tongue for me. Okay, move it side to side. Very good. Now try to push your tongue against your cheek. Good. Let me see again. Open up. Put your tongue up. Okay. The tongue is actually very good. He moves it very well from side to side. He was able to push his cheek with his tongue, which means that his tongue has a good muscle tone, possibly a +5. And with that said, we can now move forward and do the neck part this time. So at the moment, the neck seems to be symmetrical. I don't see any lesions or scarring or any lumps or swelling. No discoloration either. I'm checking any jugular vein distension, and there's no JVDs showing at the moment. I'm also assessing for any swelling of the thyroids, which is not swollen at all. Okay, so with that said, since I don't see any problems at all, we're now going to test for the accessory nerve, which controls your sternocleidomastoid muscle, which is going to be the muscle on your neck, and also your trapezius muscle, which is the muscle right behind your back. Okay, so to test that, I'm going to put my hand on across your face and try to push it to one side, and I want you to resist the force. Okay, so I'm going to hold on to that and then try to push. Very good. There's good strength there, and on the side. Very good. There's good strength there. And now I'm going to push your shoulders down, and I want to see you push it up, try to resist the pushing down, or try to push your shoulders up. Okay. Okay. Very good. There's also good muscle strength on trapezius muscles, which is very good, well controlled by the accessory muscle. Muscle tone is good. Strength is about +5. And now I'm going to try to check on your trachea and your windpipe and see if it's in the right place. So yeah, the windpipe is not deviated or anything. And while I'm palpating, I'm also going to palpate for your thyroids. And they're not swollen at all. So while also palpating your thyroids, we might as well also check for the lymph nodes, which is he's got lymph nodes on the face and the neck as well. So the lymph nodes that we're going to test first, or we're going to check, are going to be in the face side, which is going to be the preauricle ones, which is directly right in front of the ears. So we're going to check your preauricle lymph nodes over here. See if they're swollen, and they're not swollen or anything. Don't see them swollen. Your postauricle, they look good, they're not swollen. And then we'll check their tonsil as well. And they're not swollen. Your submandibular, they're not swollen. And your submental, they seem to be swollen too. Now for the neck, we're going to check for the anterior cervical lymph nodes, which are right before the SEM. So press it down, and it's not swollen. And then post-cervical, there's nothing there too. Occipital, which is behind the head. Okay, there's nothing there too. And then over the clavicle, which is called the supraclavicular lymph nodes. Press those. And yeah, everything seems to be good. All of the lymph nodes don't appear to be enlarged or inflamed. So yeah, we're good with that, and we can now proceed to the upper part of the body, thoracic part of the body. So if you can actually remove your shirt, so we can actually do more thorough examination of that using my stethoscope. Okay. Over here. Okay. Right. We can turn it over this way so we can see your back. There you go. Very good. So the upper thoracic part of the patient appears to be symmetrical. There's no skin conditions. There's no problems with lesions or erythema. Can you do some little breaths for me, please? Okay. Breathing seems to be unlabored. There's no shortness of breath. There's no distress at all. The AP ratio seems to be good, which is 1:2. Yeah, now we can try to feel and palpate the posterior thorax or thoracic area and feel for any problems there. So we're gonna try to feel first the skin and see if there's any problems with any swelling. Doesn't seem to be anything. And now we can just test for the vocal primitus on the back. So when I put my hands on your back, say 99, okay?
99, 99, 99, 99, 99, 99.
Okay, so vocal primitus was heard on all areas of the lungs, which there's no problem there. And now we can also check the lungs for any resonance or any problems with that. So we are or before we do that, actually, we should check for expiration and see. We're going to measure the recorded expiration by holding or feeling this, holding both sides of the back and see for chest expansion. Okay, so I'm going to hold both sides of the of the back, and we're going to see if my, can you turn on a little bit more towards me, please? Okay, sorry about that. And we're going to see if my thumbs actually split apart upon breathing, and at least we know if the chest is expanding very well. So I'm going to hit the sides over here, and now try breathing in. Very good. Okay, thank you. Chest expansion seems to be very good. My thumbs actually split apart on that one. And now we're going to check for, we're going to palpate, we're going to percuss the slugs and look for resonance. So we're going to do that right here. Okay. All parts of the lungs percussed appear to be resonant. There's no dullness or anything. And now we can also check for diaphragmatic excursion, since we're already doing the percussion. So what I'm going to do is I'm going to ask the patient to exhale so I can check the diaphragm area or diaphragm excursion itself. So I want you to take a deep breath or a regular breath and then exhale for me, okay? And then keep it that way for now. Okay, very well. Okay. Okay. Now, so you want to mark that area, which is right over there. And now we're going to ask the patient to breathe normally first, and then inhale and hold his breath for a few minutes or for a few seconds. Okay, breathe normally and then inhale. Okay, so these two parts over here is your excursion area. So I'm guessing it's around 4 to 5 centimeters apart. So that's actually quite good. All right, and now I'm going to listen to your lungs and listen for any adventitious sounds using my stethoscope. Just normal breaths, okay? Okay, so listen to his lungs, and there's no adventitious sounds heard. There's no rels, there's no rhonchi, and there's no wheezing at all. I've heard like all of the sounds are vesicular in the lower lobes, and everything else is clear. So everything in his lungs seems to be doing well. So now we're done with the posterior part. We're now going to move on to the anterior part of thorax. So if you want to sit straight for me, sir. Thank you very much. And now we're going to inspect again the front part of the thorax, and it doesn't seem to be any problems with the skin. There's no lesions, reddening, or erythema. I don't see any swelling. With the pen light, I'm going to check and see if there's any signs of heaving or lifts, and also the pulsations from the PMI or the other point of maximum impulse. So we'll check it over there. As I can see, the point of maximum impulse is actually over here. It's showing very well, but there's no other heaves or lifts or showing like that. Now I'm going to check for your, I'm going to palpate for any problems with your skin, if there's any swelling or any abnormality.